Yeah, good afternoon once again, everybody. The last presenter today is Rita Young Isong. So she's going to introduce herself to us and tell us her topic and then give us that insightful presentation. Rita, welcome.
Good day, my director, our visitors, and my fellow students. My name is Rita Young. I'm a student of Bioscird. So today I'm going to be talking about malaria, the types of malaria, and the types of plasmodium and the cycle of plasmodium. So first of all, I'm going to be defining malaria. Malaria is a life-threatening disease. It is a single-cell protozoa. It is transmitted to humans by the bites of an infected female Anopheles mosquito. And I also understand that this mosquito is considered as a vector, which is living organisms that transmit pathogens to between humans and animals. And I understand that when these mosquitoes are infected, they can transmit these germs to the rest of their life. They transmit it from one person to another. Okay, and I also know that there are 3,500 species of mosquitoes, but it's not all of them that concerns humans. I know about Aedes, I know about Culex, I know about Anopheles, I know about Cholecita, and I know about Manzonia. And understand that it is the Anopheles that is disturbing us with malaria. And I also know that we have approximately 1,456 species of plasmodium that cause malaria, but it's only few that affects humans. I know about Plasmodium falciparum, I know about Plasmodium ovale, I know about Plasmodium vivax, I know about Plasmodium knowlesi, and I know about Plasmodium malariae. And I also understand that among these five that I've mentioned, there is one that is very severe, which is Plasmodium falciparum. That one I understand that is very severe and deadly. If you have high Plasmodium falciparum in your body, it may lead to organ failure like kidney and liver failure, and it can also lead to death. And I also understand that Plasmodium vivax is considered as the stubborn one because of their ability for them to go and remain dominant in the liver cells that feed them. And I also know that we have the cycle of malaria. So I understand that mosquitoes carry plasmodium in their mouth. When they bite human, they will put the plasmodium into the body, which is members of the chromosome. They will now take the plasmodium, the bloodstream will now take the plasmodium to the liver. They will now remain there as merozoids. So some of the merozoids will now go into the liver cells and hide as these merozoids. So after the parasites are now mature, they will now go and be attacking the red blood cells, and the parasite is called strobozoid. And I also understand that there is this parasite that stay in our bone marrow, which is gametocide. It is the one that they are divided into two, the sexual and the asexual. They are the one that transmit malaria from they are the one that transmit parasite from person to mosquito. It's only the female mosquito that bite. The male mosquito, they don't bite because they have forked mouth. They feed on flowers, and the female mosquito bite because they want to fertilize their eggs. And I also understand that this malaria, they have complications. If you have malaria in your body, you have anemia, kidney failure, and even lead to death. So I know much about malaria and how it affects humans. So malaria must not be left untreated because it has very serious complications. So that is what I've learned so far. If you have any question, you can ask me. I want to.
Thank you. Rita's presentation is smooth. I feel like bringing Rita to come and talk to year 5 students in UNIO. So the aspect Rita has not talked about are the drugs that we use in malaria, and what part of this life cycle do the drugs work? Which of the drugs that we use for malaria work on the merozoids, affect the hypnozoids, affect the trophozoids, which I know she knows about that one, but maybe she wants to tell us that in another day, Abby. So if you have questions, let us ask Rita. Yes, Elijah has questions. Thank you very much.
You said earlier that the male mosquito can't bite you, that they have forked mouth. I want to know the name of that forked mouth of the male mosquito.
Okay.
Well, I don't really know the name, but I know they have forked mouth. I'll ask my director to tell me about that.
That curved mouth is called proboscis. Proboscis, Proboscis. Proboscis. That's the mouth of the the female have sharp, like a pierce into your body, but the male is curved. That curve helps them to suck the nectar from flowers. To bite humans is difficult. It's not easy for them. Any other question?
My question.
Still on pregnant woman?
I just gave birth and my baby is barely 3 months old. And what medication as a mother or as a caregiver can you give to a 3-month-old baby that is having the malaria?
I will give him a malaria suspension.
Or malaria suspension, but I don't know the name of it.
Okay, we have lower suspension. If the baby is 3 months, you can give him 0.5 months.
It's just the suspension. Is there no added drug to malaria suspension? Because I know when I'm sick and the doctor gives me malaria injection, they will add an analgesic to it, either injection or. So I want to ask, apart from if I don't want to give my baby suspension, can I give my 3-month-old baby injection?
Injection. Yes, we can give. I need a 3-month baby injection like that in America.
Well, a 3-month-old baby or even less can take injections if the clinician thinks that is the best for that baby. But if it's not that serious, oral medications are better. But sometimes oral medications are just not suitable because that baby vomits and the fever is high and malaria seems to be much. Then the route of administration will now be parenteral. Enteral means through the mouth. Parenteral means outside of the mouth. And there are safe ways to inject a 3-month-old baby without causing any problem. So I don't want us to think a 3-month baby is too small. You want to give an injection? No. They can be given injections. Some of them have cerebral malaria and they're going to be taking a testosterone injection. Not only once, up to even 2 or 3 times a day for like 3 days. So don't think, this baby is too small. No. So it can happen. Your baby, madam, can be given injection. They are not killing your baby. Some babies say they are so stubborn. You begin to wonder, wow. They just look at you like this. You know, everything's out. And you can't continue with oral in such cases. So let's clap for Rita. Thank you very much.